potential partnership between two major players in Hawaii's healthcare industry.
The CEOs of HMSA and HPH join us live in studio to take our questions and yours. Spotlight Now starts now.
You're watching Spotlight Now with Ryan Kalei-Suchi and Yunji Denise on Hawaii News Now. Have questions or comments for our guests? Join the conversation in our Facebook live stream. Spotlight Now, where Hawaii comes to talk.
Well, aloha, thanks for tuning in here to Spotlight Now on Hawaii News Now. We are going to be talking to our guests. Through our program, one of our partners here at Spotlight Now is Hawaii Pacific Health. And so we've invited them on, as well as with HMSA, to really cover a topic that has been making headlines throughout our community over the last few weeks. We want to thank those of you who have already sent in your questions. We've received a number of questions from you, and we always want to encourage all of you who are watching to head over to Facebook. You can enter your comments and questions there, or you can also email us here at spotlightnow@hawaiinewsnow.com.
Yeah, an unprecedented number of questions, and so we want to get right to our guest, and that is Ray Vera, the CEO of Hawaii Pacific Health, and Hawaii Medical Service Association, HMSA CEO Mark Mugaishi. Thank you both for being here today.
Thanks so much for having us.
So as Ryan said, something making headlines around the state for some time now, One Health Hawaii, a partnership between these two major organizations. Ray, let's start with you. How did this idea come about?
Yeah, well, we've been working on this for a number of years, but it really started out with a fundamental basis of the fact that we think the community is ripe for change as it relates to healthcare in Hawaii, but more importantly, affordability. As we know, affordability is probably the greatest challenge facing the people of Hawaii. And while healthcare isn't the single largest part of that, it certainly does represent a significant portion. And so we knew that we need to do something to transform the way healthcare was delivered and funded in our community that would make it more sustainable.
And from our talk to us about how this conversation even began between these two entities. Talk about maybe just where this stemmed from and how this decision was ultimately made to present this partnership.
Well, healthcare, as Ray was alluding to, has become more and more challenging. Affordability is a big issue everywhere in the whole country. In fact, we always talk about this. The country was just shut down for a long period of time because of the issue of affordability of healthcare. And that problem is escalating. We have an opportunity here in Hawaii to do something special because we have healthcare partners who view the world in similar ways. We have Kuleana for the state of Hawaii, and together we can create solutions that have more resilience for Hawaii. So HPH and HMSA have had contracts for value-based agreements that have slightly bent the cost curve. They've been successful, but there's just so much more that can be done if there's a structural tie.
Yeah, let's dive a little bit deeper into that. Mark, I'll stay with you for just a second. How much of a cost savings are we talking about?
It can be significant, and it starts with things like better coordination of care. If you coordinate care better, it means that you take care of diseases before they become worse. It means if people have chronic diseases, you prevent them from deteriorating into a hospitalization. It keeps people out of avoidable ER utilizations, out of unnecessary hospitalizations at home. All of those things are good with better coordinated care, and that will save lots of money that can be invested back into the community.
Maybe if I could add a little bit to that, if you think, again, if you step back a little bit, right now we've seen from an affordability standpoint, 23 out of 25 of the last years we've had negative net outmigration, meaning more people leaving Hawaii than coming into Hawaii. And again, as we know what some of those factors are, but just some facts about healthcare itself. We've year over year seen double-digit increases in the cost of health insurance for the people of Hawaii and for our employers in Hawaii. We've seen a trend where health systems, so the providers of healthcare, are all losing money as of 2025, and the similar is true with the insurers in the state of Hawaii. That in itself makes the system unsustainable. It's a system that is designed to deliver exactly the results that it's delivering. And so what we started focusing on, frankly, in what I would consider on a training wheels effort, is truly working on how do we focus on creating healthier communities rather than just caring for the sick. while as a mission-based organization, we're always going to care for the most vulnerable, care for the needs for those who encounter sickness or illness. But we think it's time to start focusing both from a care delivery standpoint, from a community standpoint, and from a financial standpoint on keeping our communities healthy.
Let's jump into some of these viewer questions because we said we've gotten a lot of them, and we'll start off here with Anne, who has a very basic question, and she's wondering how will this affect current HPH patients who are not insured by HMSA, for example, say insured by UHA. What will happen to patients or those customers like Anne?
Yeah, that's a great question. So let me start out with what One Health Hawaii is. It is a not-for-profit company that will sit above both Hawaii Pacific Health and HMSA. To a large degree, Hawaii Pacific Health will continue to engage with the community and our patients just as we do today. So the answer is yes. If you have UHA insurance and you have a physician at Hawaii Pacific Health, you will continue to see that physician and continue to have insurance with UHA. The same is true of HMSA. It'll be also a subsidiary of One Health Hawaii, again, a not-for-profit open healthcare system. And so they will continue to work with providers, whether they're at HPH, Queens, Castle, HHSC, or any other physician or provider in the community who currently has a relationship with HMSA. None of that changes.
Yeah, Mark, just building on that, I think, the lion's share of the questions we got were from viewers who are just saying, what specific, what cost savings here? I'll read this one from Brendan that kind of sums it up. What health outcomes or cost savings do you expect beyond administrative changes? So what changes would a patient typically feel?
So again, I shared this a little bit at the top of the show about coordination of care. We do a little of that now, but HMSA has care coordinators, HPH has care coordinators, all the other health systems have care coordinators. And because in Hawaii, people go to all the different places, sometimes somebody has 4 care coordinators. It's not only expensive, it's confusing. You get 4 different messages in your head. In an integrated system, you'll have one platform for care coordination, and we can coordinate so that you get better care and you get preventive care. You prevent diseases from getting worse, and that is a tremendous cost savings that can be invested back into reducing premiums, into investing into the healthcare delivery system so you get better care, to get more providers to our state because we now have more dollars, or to invest it upstream for healthier communities.
We have a number of questions here that all we clumped them together from David, John, Connie, and John, all asking kind of the same question. How will this merger help to lower costs for employers, for those who are responsible for other individuals? Can you talk about how the employers may be impacted by this? If they will see any significance in changes?
Yeah, so maybe I can talk a little bit about that, and I'll answer it a little broadly, or if I could, more broadly. First of all, if you're a patient, a community member, you should be asking yourself, one, am I still going to be able to see the doctor that I've developed a relationship with? And the answer is going to be yes. And is it going to cost me more and less? By design, this is intended to lower the rate of increase on a forward-looking basis for the cost of health insurance. That certainly rolls down to the employers. The employers are going to care about, are my employees going to have access to the care that they need, and is it going to cost me more or less? And we're going to be able to answer both of those, saying yes, that you're able to continue that relationship with your provider, and yes, it's going to cost you less. And I'll add one more stakeholder group, the providers, the physicians, whether you're Hawaii Pacific Health or anybody else in the community. It's going to be, am I going to be able to continue that relationship with my patient? Is it going to impact me financially? And the answer is no. I've already answered that you can still see your patient. And lastly, what's it going to do to the administrative burden of providing that care? And it's going to lower it. We can say that without question.
I watched some of the coverage, the Senate hearing, and we heard a lot of from Queens saying
Sure.
that they have some concerns about this. We know we need Queens in Hawaii, right? Only level 1 trauma center in the region, providing very critical care. What do you say about people who have concerns about the health of that system in light of what the changes that we could see here?
I think we would both agree that Queens is critically important to the fabric of the healthcare community, and there is no scenario under One Health Hawaii or a transformational process focused on healthier communities, of which Queens isn't a critical part of that environment. Frankly, right now, to care for the membership of HMSA, the other payers in the community, and also those covered by Medicare and Medicaid, and even those without insurance, it takes all of us as a system of care. And just from a practical standpoint, that's not going to change.
Right. I mean, Mark, I would ask you the same questions. We need all the providers we can get.
Yes, 100%. I mean, you see data all the time that we're short on providers, and you don't even need that data. If you're a patient in this town, you know how long you sometimes have to wait to get an appointment. That is a product of our current fragmented system. Integrating the system will help that. And it requires us to get all of the providers interested in delivering care in the same way that we want to deliver it, with this more integrated system of care where all of us are aligned on what our outcomes are.
We have.
Could I add one more example of that? So, and first of all, I have to acknowledge that, if I were Queens and we're just now getting out to talk about this in a more open fashion, I understand the concern and anxiety, and we look forward to having more detailed conversations with them and other providers. But the way One Health Hawaii changes things in a way that isn't always evident to the naked eye, if you will, is that right now they're talking about building a new hospital in Kona, which makes perfect sense. Kona needs a new hospital. It should be done in partnership with HSC, Kona Community Hospital, which they're doing, and actually I think they have identified the proper location for it. But if they were to ask Hawaii Pacific Health today to support that effort financially, it wouldn't make much sense because we don't have a provider base over there. But under One Health Hawaii, when you have the membership of HMSA, who has a number of members on the Big Island, it makes sense for One Health Hawaii to support that effort of Queens building that hospital.
So there could be actually a net benefit to Queens.
100%, we believe that will be the case.
And let me follow up on that question as we talk about the neighbor islands, because we have received a lot of questions that are coming in from those rural health communities who we know are at times it's underserved, and it's a struggle to find. We know that Hawaii Pacific Health is putting some investments also in Hilo in the expansion there. We do have a question, this one coming from Merle, who is from Hilo and says, we barely have enough Queen physicians flying here to help service us. Will the cost savings that you speak of help to maybe increase quality of care or the availability of physicians? Where could some of those cost savings be, and would that essentially maybe go to some of these rural communities?
Absolutely. Do you want me to talk about the three buckets?
Go ahead.
Or would you like
No,
to?
be my guest.
Okay. See, that's why this partnership's going to work. Yeah. So we had talked about the value or savings over the course of 10 years or so being in the billions of dollars, in excess of $2 billion on what we believe would be very conservative estimates. And when that value is created, that money is saved, and I'm happy to talk, and I know Dr. Mugishi will talk more about how we derive those savings. It essentially goes into three buckets. Now there's many, many more, but three big buckets categorized. One is, first and foremost, changing the rate of increase of health insurance, moving it from that 10, 12, 14, 30% increases per year to a more normalized rate of, call it 3 to 4%. So that's one bucket. The second bucket is investing in the healthcare ecosystem, the world of healthcare, to make sure we have the proper services provided by the proper provider in the right location at the time of need for our community. So that specifically gets to opportunities to invest in the neighbor island and add specialty care capabilities because it makes sense from a One Health Hawaii standpoint. And then the third bucket is investing in the upstream activities of our community that we believe collectively drive the greatest degree of health, as much as 75% of it. Those are things like early childhood development, K through 12 education, food insecurities, affordable housing, workforce development, mental health provider services.
Mark, if you could expand on that and where you see that when you think about that $2 billion, and I know, Ray, you're going to tell us specifically where that's going to come from, but from HMSA's standpoint, where are the cost savings? Like, how do you, and then the other question that some folks had asked also is, will there be layoffs?
Yeah, so cost savings come from a variety of places. The most important one is impacting the trend, the healthcare cost trend, the cost of care. And that occurs, number one, by better coordination of care that I explained earlier, and that's probably like the biggest bucket. That really, there's a lot of opportunity there. But other places is an integrated model of care aligns incentives. So everybody is aligned to put the right care at the right place in the right setting. And as a, for example, a procedure done in a hospital might cost $25,000. If you moved it into an ambulatory surgery center, it might be $5,000. That's a $20,000 savings that you could save and accrue to other kinds of care. Similarly, if somebody ends up in the emergency room and they have a $10,000 bill, same bill at an urgent care is in the hundreds as opposed to that. And in fact, if they saw their specialist or primary care physician in the office, it's in the low hundreds. So there's lots of advantage for having a total alignment of where we want people to have that. That's the second bucket. The third bucket is operating and capital, better synergy on those things, like just better. And for example, in operating things, we can share some administrative savings for things that we both have, like IT departments, areas like that, finance, human resources. And does that involve layoffs? In answer to your question, absolutely not. We're going to need a lot of people to run our companies, and where there's duplication, they retire, they move jobs, they take on different things, and that can easily get us to the place where we need to get to.
So what I'm hearing is if there are people who are duplicating duties basically through attrition is how you end up with those cost savings. So Ray, do you think that there will be layoffs at your organization?
Absolutely not. I've made a commitment very publicly that we won't. Hawaii Pacific Health, when we came together on December 21st of 2001, we were three organizations, Kapiolani Health, Wilcox, and Straub, who were all in some form of distress financially. So we didn't have the ability to bring the organization together in a deliberate, thoughtful manner without a burning platform. That is not the case today for HMSA and Hawaii Pacific Health. While it's unsustainable if we don't take action now. We don't have a burning platform of distressed organizations. We have the capacity to do this in a thoughtful way that uses attrition that already exists at the 11-12% per year to do this in a right way without putting our employees in harm's way. The other thing you asked about, when did we start talking about this? And I feel compelled to share with you. I personally started thinking about this and have engaged with HMSA and their leadership over the course ever since then. In 2006, when I was the CEO of the 4 hospitals within Hawaii Pacific Health, we saw the census, so the number of patients we had in our neonatal intensive care unit at Kapiolani. Our sickest kids, the sickest kids in Hawaii, quite frankly, go down. And it caused a real financial concern for the viability of Kapiolani. And I woke up one morning and said, look, I'm sick to my stomach. I shouldn't have to worry about having more sick kids in order to fund our healthcare future. That's a system that is designed that needs to be broken. It's not right. I would argue it's not morally right. And so we set out on this pathway of building up the skill sets to allow us to do just what we're doing now, which enable us to get away from a system that is funded based on volumes of activity and instead is funded on how well we do at keeping our communities healthy. We've proven through the relationship over the last 4 years where we moved to that model between our two organizations that we can do that. We can bend our cost curve and we can provide a higher quality of care. And so now what we're doing is extending our arms and saying, let's bring the community as a whole into this and make it that much more of an impact for the community we serve.
I want to follow up on something that you had mentioned in which you said that if we don't change anything, it is not sustainable. And one of the things that we have heard, and we've also seen with other companies, is the influence of an outside company outside of Hawaii coming in. How real of a threat is that when you look at these potential influence from people outside of Hawaii? Yeah. If this doesn't go through, what would that look like? And why is that a reason why you guys are promoting this partnership?
Well, I would say that this is a national trend now, this consolidation of larger for-profit, sometimes companies from the continent going around and taking up smaller regional plans. In fact, this year in Blue Cross Blue Shield, 4 plans got consolidated under a bigger umbrella. You can see it happening. And you know, it's not something we would ever entertain at HMSA because We are from Hawaii. We are for Hawaii. We were founded by social workers 87 years ago who cared about the people on the plantation and said, for the sake of Hawaii, we're going to run this health organization. So that is not in our mission to do that, but we have to find a different solution, that means. And doing exactly what we're doing now does not find a different solution, but the opportunity to partner with another local organization that similarly is not for profit, that has the same mission of a healthier community, that is an opportunity we can't afford to let go.
Yeah, Ray, sort of following up on that, when you say it's not sustainable, the current system, not sustainable for whom? The patient population, the companies themselves, I mean, the state as a whole. Are you without this, would HPH or HMSA not be able to continue?
Well, I was going to say yes and yes until you added your last sentence. Yes, it's unsustainable for the patients. I think patients and employers, which most of us get our insurance through our employers, find it unsustainable to have double-digit increases year over year, especially when you think of all the other pressures of affordability. That's unsustainable. And we hear about it. We hear about it from employers. We hear about it from patients. And we also know that it's unsustainable for the healthcare systems. Even organizations with strong balance sheets, if you will, just speaking purely financial, can only sustain losses for so long. I mean, think about the history of Hawaii. It used to be that if the big five were healthy, Hawaii was healthy. None of the big five are left in their current, the way we once knew them. And so we can't afford for that to happen with Queens, Hawaii Pacific Health, HMSA, even Castle or HHSC. Just think about how much the state has to contribute to HHSC on an annual basis to provide care to those vulnerable populations. So again, I want to redirect this. Yes, we're talking about One Health Hawaii. And yes, we're talking about the vertical integration and partnership of our organizations. But more importantly, what we're talking about is creating a sustainable healthcare system that is focused on creating health for the people of Hawaii, that allows us to invest in those three buckets: bending the cost curve, investing in the healthcare ecosystem, and investing in those social economic factors that drive healthier communities. Arguably, if we're successful at investing in early childhood development, K through 12 education, getting a roof over people's head, not have kids worried about where they're going to get their lunch from, and those types of things, they will live healthier lifestyles. We'll be dealing with less diabetes, less chronic diseases, less issues from a community health standpoint that plague our communities. And so we are intending to move from a system of care that just cares for the sick people reactively to proactively changing for the generations to come what health in this community looks like. And I think because we have the ability to do that through this collective transformational effort to a more value-based system versus a volumes of activity-based system, because almost all of the health systems in the state of Hawaii are on the same electronic medical record, and frankly, because we steward over one another differently than most communities, we have the opportunity to do something really special for the people of Hawaii, and maybe, just maybe, serve as a petri dish for what's possible in other communities around the country.
I just want to add one quick point about that. In a state like ours, where the bulk of the health dollar is subsidized by employers because of our Prepaid Healthcare Act, when we bend the cost curve and lower premiums, it allows the employers to pay better wages, because they don't have to pay it on health care. And that can be an economic stimulus and something wonderful for the whole state and for the people who work here.
We still have a lot more questions from ourselves and, of course, a ton from you. So we're going to get to those in just a few minutes. We're going to take a short break. Stay with us. We'll be right back.
Hello and welcome back to Spotlight. Now we're continuing on our conversation of this potential partnership between Hawaii Pacific Health and HMSA. We want to thank all of you who are tuning in and sending in your questions. Once again, you can head over to Facebook and enter them in the comment section, or you can email us here at spotlightnow@hawaiinewsnow.com. We're continuing to track and get as many in as we possibly can.
And we want to start off with the patient experience again, because we're hearing so many patients ask, what's going to be different for me? So, Ray, let's start with you. If I'm a patient and I'm under this new One Health Hawaii system, how is my user experience, for lack of a better term, different than what I'm experiencing now?
Well, of course, I want to start out by saying it's going to be a better experience. But first and foremost, what we want you to know is maintain that relationship with that care provider you have, whether that's your primary care provider, your specialty care provider, whatever those care needs are. That relationship between the patient and the provider is paramount. And so we want you to maintain that relationship, whether they're Hawaii Pacific Health or some other provider in the community, first and foremost. Next, the patient experience is over time, because it doesn't happen overnight. We'll begin to see that reflected in the cost of your insurance premiums, and so effectively the cost of your health care will go down. And lastly, we believe that because of the value creation through One Health Hawaii, we'll be able to invest in other provider needs throughout the community, not just within Hawaii Pacific Health, but whether it's on our neighbor islands, in our most vulnerable populations, or supporting those who are already providing safety net services, which frankly all hospitals in the state in some form or fashion provide safety net services, as do many of our independent physicians. And so we will work alongside that entire provider to community to make sure that we expand access throughout the state.
Yeah.
And I'll just add to that some of the frustration that some patients have now is with us, the payer, right? Whether it's because pre-authorizations take time, or because it's hard to understand the bill that you just got because it's like in Greek or something like that. But when you have an integrated entity, you can simplify all of that because we share data. And we share the member and the patient are one and the same person. In our worlds today, they're different, and so it's fragmented. So the experience that comes back to the patient is fragmented as well.
I want to add something just because I know what the next question you'll get on Facebook is. That doesn't mean that Hawaii Pacific Health and HMSA will be sharing data about other providers or other payers with one another. So the Hawaii Pacific Health relationship with UHA, as an example, since you asked that earlier, will be firewalled from HMSA, and HMSA's relationship with other providers, whether it's Queens, Castle, independent providers, will be firewalled from Hawaii Pacific Health.
We are getting questions about what this transition would look like, and Brenda was asking, is there going to be a system in place to educate customers on the changes and prevent loss in coverage? What can these customers expect if and when this does go through, the type of communication that's going to be coming forth, and how you're going to be working to ensure, to Brenda's point, that there isn't a lapse in coverage?
We will communicate. Absolutely full transparency is important. Although truth be known, there shouldn't be much disruption of any kind, because as Ray pointed out, we want people to continue to stay with their same provider. We want them to stay with their same insurer if it's not us. And we're going to, over time, simplify the experience, and we will communicate that. We also have neighborhood centers all over the place. We have call centers, and we will absolutely be ready to speak to anybody who needs help.
Can I share a quick story about what that might look like, or what I've experienced? And so look, we're in the provider space, Hawaii Pacific Health is, and we advocate for our patients on a daily basis. And that comes in all different forms and fashion. So we had a family with a child with special needs. And that special need was that child had a tracheotomy, a hole in their throat with a device to help them breathe. Their physician decided that there was time for that device to come out. Well, the way that process works is you have to replace it every couple of weeks with a smaller device so the hole gets smaller. And you do that because the longer you leave that hole, the more likely an infection is, which would result in a costly admission. So as we're helping this family, they were trying to do that. The family requested the smaller devices so they could go through that process. It's called decannulation. They could go through that process. And the device never came from the medical provider, the medical equipment provider. And after weeks and weeks of frustration, the family finally reached out to the medical equipment provider and said, is this a money issue? Why aren't we getting the device? And the answer was yes. The insurer, and it wasn't HMSA, didn't approve that device. Okay, and so the family said, well, how much are they? And they said, well, they're $80. And the family said, you're putting my child at risk. I would have gladly paid the $80. It could potentially cost the health system tens of thousands of dollars. And the child eventually got the device because the family paid for it. Now, here's the interesting point of that story. That was my child, and that was my family. And I'm as close to healthcare as you get. And I had no idea the ecosystem of care, were causing the delays in that care, putting the child at risk, and frustrating the family at a point where they frankly didn't have capacity for more frustration. And so if we're able to do that for one family, this transformational process in One Health Hawaii will make it a huge impact.
Yeah, and so the difference under the system that you're proposing would be that then that kind of roadblock would be gone.
That would be the intent. That is absolutely our intent, are to remove those administrative barriers and get, frankly, the resources, mostly money, closest to the provision of care as possible, with as little administrative obstruction in between.
Let me ask you this. We've heard a lot about the word merger, and words are important, and in this case, they really matter. So there's partnership, there's merger, and a viewer is asking, how is this not just a merger? So, Mark, let's start with you. What's the difference?
I think typically what a merger means is you have two companies and then you have one because they come together. That is not the case here. We will have two companies who will retain their legacy functions and continue to service the community as they are, and a common parent organization that will help determine strategy to align the incentives between the two companies. So that is a partnership in our mind. Let the lawyers decide what the exact word is, but in our mind, we're partners. We're going to retain our identity. For us at HMSA, it's take care of our members. The 87-year tradition of making sure people feel secure and safe with their coverage. HPH will continue to provide great quality care and strive for healthier communities.
Yeah, if you would just expand on that, about what's the difference?
So it's exactly right. It's from a legal structure standpoint, you have a new parent company, One Health Hawaii, sitting over two subsidiary entities which will continue to engage in the community the way they have in the past. And by doing that, what we'll do is we'll create that value through eliminating administrative burden, eliminating administrative corporate costs, and creating more coordination of care between not only our system, but everybody who joins in on that transformational process, which we would expect all the other providers in the community to be part of, because it's in the best interest. We should all be focused on healthier communities. Now, you may ask, because I've been asked it a dozen times, well, probably dozens of times, why can't you just do that contractually? And we've made progress contractually over the last 4 years, as I said earlier. But the fact is, you've got to understand the different roles of the players. The providers are, and I believe the insurers are looking out for the best interests of the patients, but the providers are providing that care. And essentially, the insurers manage the funds flow, the resources. They're a financial organization, and the problem is, and I don't know if Dr. Mugishi likes it when I say this or not, but what happens is money goes in to HMSA, as an example, or any other health plan, and is put in by the members, and money goes out to the providers for the provision of care. But the fundamental problem is everybody who puts money in wants to put less money in, and everybody who gets money out wants more money out in the current way healthcare is funded through the volumes of activity scenario. And so we have to change that reality. And the fundamental problem is you have to create a trust that is embedded between the two organizations, so that you don't need all this administrative architecture defining or justifying why you need to put so much money in, or why so much money is going out, or not enough money is going out. I liken it to this, and I often get in trouble when I use this analogy. But when you start dating somebody, you don't give them the ATM pin right to your bank account. And when you get engaged, you stop covering the keypad, right? You stop doing that. And then when you get married, you just give them the card and the pin, and figure out who needs money when, right? It's not that you don't trust them, but there's only so many things you can do without a structural connection.
We want to also just follow up on that point about this term merger. Edward is asking, when HMSA's financial priorities conflict with HPH's clinical decisions, who has the final authority? How will this be enforced in practice when there may be some sort of disagreement? What does the structure look like for this agreement in the long term?
So One Health Hawaii will have the two of us running it, and we will have an independent board, all of whom will have the same priority, which is the best interest of the patient/member and the state of Hawaii. So I actually don't anticipate there will be that many disagreements, and if there are, we will resolve them by acting in the best interest of the patient and member.
Okay. There's some questions coming in on Facebook just about the experience for the physicians. We've been focusing a lot on the patients, but let's start with the physicians, or let's move to the physicians rather, and thinking about, there are set rates, but under this system, couldn't Hawaii Pacific Health kind of poach the best doctors? There is that fear expressed in a lot of these comments.
Yeah, I mean, I guess I understand that fear, but the reality of it is we've already shared and determined that it takes the entirety of the ecosystem in order to care for the members of HMSA, all the other health plans, and the government payers. And so I can tell you that nowhere in our planning, nowhere in our financial analysis does it include attracting more physicians from other provider groups or attracting more patients from provider groups. And I should add, or eliminating any of our employees through reduction in forces. And so it's just that is a reasonable emotional concern. And I would feel the same way if I were a provider who wasn't part of these initial discussions, but it's a practical impossibility. It takes the ecosystem as a whole. And like we said, if we all commit to this transformational process and being part of that, it becomes from a One Health Hawaii standpoint, provider agnostic. If you're in the tent, which we want everybody to be in the tent who's committed to that value-based commitment for our communities, that healthier community strategy, it doesn't matter whether they're Hawaii Pacific Health or any other provider organization.
Yeah, I mean, Mark, what do you say to physicians who say, well, if I don't work for HMSA or for HPH, is HMSA going to pay me a lot less because I'm not part of this One Health Hawaii system?
No, we are interested in making sure all physicians and all health systems have a sustainable business model because we need them, as Ray said. And I hope I have enough credibility where people believe that I'm sincere at that, but if not, there's also good evidence everywhere in the country. So this concept of a vertically integrated delivery system where the financing and the delivery are tied together is not unique. It exists in many other places in the country. And in almost all of those places, anywhere between 50 to 80% of the care to the insured population is delivered outside of the integrated provider partner. And that's because most of these places, they just need all of that care delivery asset in order to take care of all the patients.
We do kind of have a follow-up question on that. They're asking if there would be more priority or if it would be easier for those who are involved or under this umbrella to get reimbursements quicker. Will their process be faster than someone who's independent and outside? Is that a benefit to this, or will it each be treated equally?
They should all be treated equally, provided that the other providers embrace the same value-based community health construct that we're doing. So we're going to ask people who aren't under the tent, like, here's how our relationship is. Will you commit to the same outcomes? Will you commit to the same payment model? And if the answer is yes, we'd like to do everything the same way with all of them.
Okay.
I want to go back because I feel like we said it earlier, and I want to, I hope I can articulate it in a way that makes sense. This is much less about One Health Hawaii as it is creating a transformational process, the way healthcare is delivered and funded in our community that serves in our community's best interest from a health and well-being standpoint and an affordability standpoint. One Health Hawaii only serves as an enabler that allows us to unleash that value to invest in the areas that would allow that to be successful. This is about the problem of sustainability isn't about any one or two or group of organizations, whether it's on the payer side or on the provider side. It's more about the system design of the way healthcare is delivered and funded. This is exactly what the Affordable Care Act was designed to move our country towards. It's quite frankly, you'll might get a chuckle when I say this, it's the construct in which Kaiser was designed and has been successful for a very long time, except the fact that they have a more closed community. You have to be part of Kaiser. And that's the difference, is we're taking that system value creation and applying it to everybody in the community through an open system.
Yeah, I want to stick with you on that because a lot of people have said, well, isn't this just Kaiser?
It looks a little bit like Kaiser. It employs some of the same principles as Kaiser, but the key difference, and it's a big difference, is that this is an open system. In other words, I know everybody doesn't necessarily know what an open system means, so what it means in lay terms is you can continue to see your doctor regardless of whether they're Hawaii Pacific Health, Queens, Castle, on a neighbor island, or wherever that relationship exists. That is the biggest difference.
Mark, I want to point this question to you as we continue to get more questions that are coming in, specifically about the neighbor islands. Nidra is asking about how patients on Maui will be impacted by this, especially with hospital service. Will they continue to be available at Maui Memorial Health and Maui Health in general? And also, how will HMSA doctors be affected specifically for the island of Maui? What can you tell us or speak to those who are concerned that seek service on the Valley Isle?
Yeah, thanks for that question, because Maui is a high priority for HMSA and for me in particular. My dad grew up on Maui, went to Baldwin. I love the island. We need to do better for Maui. I think it's actually the experience that a lot of people feel on Maui has to do with the fact that the system is very fragmented there. And this is an attempt to strengthen it. In order to do that, yes, we will need 100% the partnership with Maui Memorial. We need their hospital. They're the only inpatient hospital. As you know, HMSA, in partnership with Halemakua, we are building a careplex for outpatient specialty care, ambulatory surgery, and women's health on the Halemakua campus. We are bringing integration there with providers in the community, but we'll need other providers because some of those providers don't exist there now. So One Health is the ability for us to partner with anybody else who's in our partnership, whether it's Hawaii Pacific Health or Queens or anyone else, to bring care delivery to Maui along with the local providers to make it a better experience. Currently, I'm not sure if your viewers know this, but in partnership with Queens, we bring OB/GYN services to Maui with HMSA and Queens together, and we will continue with that type of partnership on the neighbor islands.
Yeah, I want to ask you this one. This is from someone who goes by the name of Glow. How will this partnership ensure that safety net hospitals aren't left with only the most expensive, uninsured, or critically ill patients? And we've heard this question in a variety of ways.
Yeah.
That basically this system will pluck the easiest patients to take care of, and that the people who maybe have the least resources or have the most complicated cases could be left out.
Well, the way I answer that question, first of all, is I've been doing this for a long time. I've been in healthcare for 30 years, all on the provider side, and I wouldn't know how to do that because the patients generally go where their physicians tell them to go, or where the ambulance takes them, or where they show up into the emergency room. So I wouldn't, as an administrator or as an executive in the company, necessarily know how to do that. But I also want to reflect on the fact that, as I said earlier, safety net hospitals or services are spread throughout our community. We are grateful that Queens provides, as an example, inpatient mental health services. They are the state's level 1 trauma center. At Straub, we have the burn unit. At Kapiolani, we take care of all the neonatal intensive care unit patients, not all, but the far majority, and certainly the sickest. Same with pediatric intensive care, same with pediatric oncology. All of the neighbor island facilities, to include Wilcox, but also the HHSC facilities, serve as safety net facilities. And so it's easy to ask that question with one thing in mind, but you have to, what we're trying to do is look above that and think of the entire system of care serving our community. And so if there's a need in one of those services that are a safety net service and it's not provided at Hawaii Pacific Health, what we're going to do under One Health Hawaii is trying to figure out a way to best prop up the service where it's best served. The fact is, to have Hawaii Pacific Health get involved in inpatient mental health services is not the highest and best use of the resources, because the skills already exist at Castle and at Queens. And so we should support those services where they exist today.
Again, we know that this may be somewhat repetitive for you, but we are just trying to address all the various questions and populations of people that are watching. And we're getting a number of questions about the kupuna. We know that, a lot of times for our seniors, they have multiple doctors who are stretched across different specialists who may fall under different categories. What would you say, how would this help or impact our elderly population and those who need those, care from various providers, and if this could be something that's beneficial or something they'd have to transition into?
Yeah, I think this integrated concept that we're having would benefit the vulnerable people of this population, including our kupuna, the most, because coordination of care helps the vulnerable the most. And when you think about an elderly clinic, for example, before somebody is sick and has to get admitted to the hospital, where they could go and get wellness treatment and be well, that would be wonderful, but we don't have them in Hawaii. And why is that? Because we see the need for it on the payer side. We go, my God, if we took better care of these elder people where their coordination of care is such that we catch them before they're sick, that would be wonderful. But we don't have care delivery assets. Providers don't have the payment model to pay for that. They get paid for when somebody gets admitted to the hospital. So when we put ourselves together, we can start to consider this concept of we should have a kupuna health center and put people in there that can coordinate their care and make sure that they're healthy. And I could see that as one enlightened vision for giving better care to kupuna and more affordable care for the state of Hawaii.
I'm curious to know, sort of widening out, what's the timeline now? Where do you go from here? I know you had your Senate hearing. The state doesn't really have a lot of regulatory oversight on this, as far as I can tell.
Well, the key regulatory processes are, which we will be filing those prior to the end of this month, are for a certificate of need through the state of Hawaii. We've already engaged in conversations with the insurance commissioner, the attorney general's office, and of course now the legislature. We expect those conversations to continue. But besides the certificate of need process, which is a statewide process, there will be a federal process. We will apply for federal regulatory approval. It'll be determined federally whether that goes to the Department of Justice or the Federal Trade Commission. And then we will work with that respective body to answer their inquiries and questions to our regulatory filings. We anticipate that would take 6 to 18 months. And so while there's not as many approvals required on a statewide basis, certainly the voice of the governor, the attorney general, the legislature, and others matters in the eyes of the regulators federally. But ultimately, there's key legal questions that have to be answered, which we believe will be.
And just so that I'm clear, both of you will stay in your respective roles. You have boards that take care of, that oversee your companies, and then One Health Hawaii would have its own board. Would it have its own CEO as well? How did that work?
Go ahead.
So actually, if all of this is approved and we form One Health Hawaii, Ray and I will become co-CEOs of One Health Hawaii. There will be continue to be an independent board at each of the HMSA level, an independent leader, but we will have a new independent board at One Health Hawaii, which will be community leaders and industry experts at building something like this together so we can really build the best company for community health.
So let me say one more. So what exactly is Dr. Mugishi just said, except he will no longer be the CEO of HMSA and I will no longer be the CEO of Hawaii Pacific Health. We will jointly run One Health Hawaii.
And if all goes according to plan, what does the timeline look like, and the next steps moving forward? How, what does this roll out? As you talked about some of the regulatory things, but conversations that also might be happening within the community, within your organizations, and overall timeline on when this could realistically take place.
Yeah, so Ray mentioned 6 to 18 months. I think that is those are good timelines to bank on. Once we get together, then there's the actual work of integrating, and that will take time. So the actual value will accrue to the community over time. We are being very, very transparent with our own organizations. I know Ray and I talk all the time about how we're sharing this with our employee base, because yes, This is scary change is always scary for the broader community. It's very scary for our employees too. So I think we're taking a lot of care explaining to them why. I'll just back up a second and say almost everybody works for HMSA because they love the mission. They believe in the health of Hawaii. They believe in the people they serve. So it's just reassuring them that this is taking us a step closer to doing that better. And once they understand that, I think it's we're getting more comfort with people moving along in this direction.
Yeah.
If I could just add something
Please.
to that. So until we get regulatory approval, each entity will continue to operate independently as they do today. We can do some planning for what it will look like the day we get regulatory approval, but we can't act on any of that prior to getting regulatory approval. Once we get regulatory approval, we will close the transaction within days and then start the true integration process.
We're almost out of time, but I'm curious, as you've been engaging with your various communities, with lawmakers, I'm sure you can't go to longs without somebody having something to say. What's the biggest misconception? Like, what do you want people to really understand about why this is needed and why you are pursuing this? Because it would probably be easier for you to each just run your respective companies and not take this road. So Ray, let's start with you.
Yeah, the biggest misconception is that I'm going to lose the relationship with my doctor, and I'm going to have to see a Hawaii Pacific Health physician. And that couldn't be further from the truth. That's not what this is designed or intended to do. What I want people to know is that it is time to disrupt a system that has been broken locally, on a statewide basis and on a national basis for a long time to come, that truly focuses on creating healthier communities. The reality of it is the United States as a whole spends more money on healthcare than any other developed country, and we have lower mortality than the far majority of them. We need to be looking upstream and deep into our communities and think about how we create healthier pathways. And we do that through creating access, through creating affordability, to addressing our most vulnerable populations, and nurturing the relationships that exist between the providers and their patients.
Mark,
And I would say as a former physician, well, I still am a physician, but as a former practicing physician, my former colleagues come up to me a lot and ask me the basic questions as a provider. Am I going to still be able to see my patients? Are you going to pay me less money? Are you going to make my life easier or harder? Should I get a job at Hawaii Pacific Health now? And the answer is, number one, yes, you will always be able to see your own patients. The relationship between the provider and the patient is sacred. It's always been sacred, and we will always preserve that. Secondly, we will pay every provider a sustainable amount so that they can continue to practice as they do. Third, fully intend to make their life easier. All the administrative hassles that we have now by having a fragmented system, we can combine them and make them better. And fourth, they should work wherever makes them happy. And if they're happy where they are, that's great.
Okay. Well, wow, we covered a lot of ground. Thank you both for being here today. I know also, before we go, there is a website if people want to learn more. And I believe that's One Health Hawaii.
No, Healthier Hawaii
Oh,
Together. HealthierHawaiiTogether.com.
Got it. HealthierHawaiiTogether.com. I went through and looked at all the FAQs as well before we started. But thank you so much for being with us today. We really appreciate you both taking the full hour to be with us.
Thanks so much for having us.
And thank you for being with us. Stay with us. We'll be right back.
From the moment you wake up.
Hawaii News Now brings you the stories that impact your day.
With more on the breaking news, we go live to Casey Lund.
Ready with the push alert? I'm going live. We have an update to the breaking news we brought you this morning on Sunrise.
Okay, guys, as soon as this wraps, toss to Mahia.
And we've been covering this story all day.
Now we go live to Mahia for a new development.
Stand by for breaking news. They just captured the suspect.
That's confirmed?
Yes, sources just confirmed it.
The news you need the moment it breaks.
Here on Hawaii News Now.
First alert traffic is like always having a helpful passenger right next to you.
There's a crash up ahead in the left lane.
When we see a backup, we'll tell you live on TV.
That doesn't look too good.
And send an alert to your phone.
I'll type, you drive.
First alert traffic on TV, streaming, and on the Hawaii News Now app.
Keeping you and your ohana safe.
Spotlight Now with Yunji Denise and Ryan Kalei Suchi. Connecting you with newsmakers from throughout our islands. Going in depth with Hawaii's leaders. And taking your questions live. Spotlight Now, where Hawaii comes to talk.
Well, we want to thank all of you for your many questions that have come in about this topic, about this potential merger between Hawaii Pacific Health and HMSA. We heard from both of the CEOs there today, really stating their case about why this is not only needed, but really it is important for the future of healthcare in Hawaii and the sustainability overall for this not merger, but partnership to happen between these two entities.
Yeah, and they really dove into a variety of perspectives. What does it mean for the patient? What does it mean for the providers? What does it mean for our communities as a whole, whether you live in a rural area or in urban Oahu? And so it was very interesting to hear their perspectives. If you missed any of this, we encourage you to go back and watch it again. You can also catch it as a podcast. And we really do appreciate all of you weighing in with all those questions. It was wonderful to have all of you as part of our discussion again. We encourage you to start sending questions for next week's guest, and that is the governor. He is going to be fresh off the State of the State address on Monday and join us right back here on Tuesday.
Yeah, he's going to be laying out his vision for what could be his, well, not what could be, but his fourth term in office. He is up for re-election this year, but really a great time to really catch up with the governor to hear about some of his local priorities, but also what's happening on a national level. Governor Green has been very involved in what has been happening in Washington, D.C., and really a lot of questions about the budget are coming up. So a lot of questions to ask to the governor on our next show on Tuesday.
We hope to see you then. Until next time, aloha.